Hey guys, welcome back. So today we'll talk about treating hypothermia, which is a very high likelihood with the temps that everybody's been seeing across the country the last few days to a week. So first thing we need to do is recognize what hypothermia is. It's going to be a core body temp that's going to be getting below what's normal. So from normal temp down to about 95 degrees, you still have the ability to shiver, and what that is that's your muscles trying to generate energy by movement. That's when we consider somebody to be a mild hypothermia. Once somebody goes below 95 degrees core temp, then we consider them to be moderate hypothermia. The big sign here is they lose the ability to shiver. So it's important to try to keep our core temp up, and there's a couple different ways that we can do this. So if we have somebody that's hypothermic, the first thing that we need to do is call 911, get help on the way. The next thing we need to do is gently remove them from that environment, get them in somewhere where it's warm. And the reason that we need to be gentle when we're moving these patients is because that if you're too rough handling them, you can actually put them into a cardiac arrhythmia. So next thing we need to do, if they have any wet clothing, is we need to remove the clothing and pack the heat loss areas like the armpits, the groin, around the neck, cover the head with something to prevent heat loss. And when I say pack it, we're going to use something like hot hands, something that gets warm but not too hot. Anything that reaches a temperature greater than 104 can actually cause some tissue damage. So these things work great. They last about 12 hours. Hot packs, not so much because they get a little bit too hot and they don't last quite as long. So after we've done this, we've got the clothing removed. We've put some warm packs in those heat loss areas. The next thing that we can do is take something like one of these Mylar blankets. These things are paper thin. But they work very good for reflecting body heat. So you can take the Mylar blanket and actually wrap it around the victim and cover them up with this Mylar blanket. Now, the thing about Mylar is that it will reflect body heat. So if you have somebody with core body temp less than 95, the Mylar blanket is not going to really reflect that body heat. And you have no insulation value. So if you have some type of blanket, like a wool blanket, wrap your victim up in this and then wrap them in that wool blanket. So if you have somebody that you're worried about frostbite to the extremities, we want to warm the core first. We don't worry too much about extremities until we get that core temp back up to where it's supposed to be. Then you can start rewarming those extremities. Never rub these extremities because if they do have frostbite, they can have tiny ice crystals that are in the muscle tissue. And when you rub it, you can actually cause damage to the muscle tissue. So another way to really help warm core temp back up is to try to give them warm fluids, hot chocolate, coffee, something along those lines that are going to help warm that core up from the inside. A lot of the time, if patients come into the hospital and they have a really low core temp, they do something called a warm gastric lavage. And all they're doing is taking warm water and pushing it down into the stomach and then pulling it back out, pushing more warm water into the stomach and pulling it back out. This is one of the best ways by getting warm fluids in them to help warm that core temp up. So that's about it for this. Thanks for watching. See you on the next one.